Chantal, yeah. So tell us about yourself first. Who is Chantal, and then what you do, where do you work, and so on. Let's start with you
Okay,
because
perfect.
yes.
Hi everyone. My name's Chantal BOUDREAU, or Chantal, depending on if you speak English or French. I am a cancer patient navigator in Nova Scotia. So I know there was definitely some conversation earlier about whether there is a navigation program in our province, and there very much is. So I work for Nova Scotia Health, which is the health authority for the province. I'm a registered nurse, so all of our navigators are registered nurses, and I
Mhm.
currently work in Bridgewater, which is a part of the South Shore. So essentially, our navigation program started back in 2002 when they did a pilot project for the province. And there were 3 navigator positions that were created at that time just to see if this role would be of benefit to patients and families, help them feel more supported and kind of linked in with the healthcare system. Obviously, as I'm sure we've kind of been talking about all today, it was very evident that these positions were required, and quickly there became navigator roles for all of our rural sites. So
Wow.
essentially, we are county based. So we're community cancer patient navigators. So for myself in the South Shore, I look after 2 counties. So if you pulled up really a map of the province, we're divided based on counties. So I look after Lunenburg and Queens County. There are essentially, we're based, like I said, we're divided by counties, but we're also based on the zones as well. So there's 4 zones in our health authority. You can find all of our cancer patient navigators online. So essentially, if you did a quick Google search of Cancer Patient Navigator Nova Scotia, the link for our services does come up through like the Nova Scotia Health website, and all of our names and what counties we serve and our contact information is listed there, as well as like the pamphlet about navigation, and how to refer to us. So essentially, in my role, I ultimately, when I explain to people what I do, I'm a support person to you. Um,
Mhm.
so I like to divide it into kind of 3 different areas. I do specify I'm a registered nurse because a lot of what I do does overlap with other roles in the healthcare team. So I can help with coordination. So all of the questions about screening, about diagnostics, about referrals to oncology, down to like when you're into treatment and even beyond. If you're having issues with any of those coordination pieces, or you're unclear of what your plan of care is, how to move forward, where to reach out, who to reach out to, um, I can assist with that. So I obviously either have contact information or I have someone I can reach out to. I always refer to it as behind the scenes contact information that patients may not have access to. So I am definitely a direct support to any patient there.
Mhm.
Um, I do provide a lot of education. So I've worked in oncology now for 12 years. So all of my nursing career actually has always been in oncology. It's a very, very passionate area of mine. I've done different roles, so that all of that experience definitely helps in this role. So I do have a background of systemic therapy training, so I can help with education with regards to treatments. And a lot of our navigators can, even if they don't have that specific background. We relatively are like educated on treatments that patients are going through, common side effects, and how to support people through those treatments. And obviously, we can also to help again to kind of navigate you, as to who you could reach out to if we're not able to provide an answer. And then lastly, in a community-based role, we do a lot to do with resources and supports. So I definitely get lots of questions to do with the financial aspect, and I always say this is where my role overlaps a bit with the social worker, even though I am a nurse. So I'm aware of anything to do with travel concerns, medication concerns, um, living expense concerns. I can help see if there's community supports, programs, resources, whether it's provincially, locally, or even federally, that might be able to help support you there. And then I also can help with referrals. So we do a little bit of everything. Our role as community navigators don't just end like when you're finished treatment or at a certain point. We literally follow people through the entire trajectory of their cancer diagnosis. So up to like onset of diagnosis, all the way really till end of life. We're there to support you. There are other navigator roles within our province as well. So recently, in the last couple of years, they've created referral navigator roles, specifically out of our main cancer center in Halifax. So I believe right now there's 5, if not 6 referral navigators. They're site specific. So they do only get in contact with people when a referral comes through to oncology. They help with the triaging process and with the referral office to make sure everything is in place before and up to your appointment with oncology. They're there to offer education support and anything in those areas. And then sometimes too, it's a matter of them like reaching out to the community navigators if they realize a patient obviously lives outside of central in one of our areas. And then we do have, I think, a breast screening navigator, a lung screening navigator. So there are navigators specific to some of our screening programs, again, to offer like education support through those processes. So yeah, so it's definitely sad to hear at times that navigation still is like not heard of in the province. I don't know specifically, like if earlier, because there is still a gap in Central, which is HRM, so Halifax, which is where our cancer center is, our main cancer center. There's no specific community navigator like myself that covers that region. So that is a huge gap that we recognize and we try to advocate for to hopefully get that support to patients. But it's kind of in the works. I guess the thought is that there are other resources such as social workers and the cancer center that would help support them. But there's definitely a large group of patients that may not actually ever see the cancer center because they go through surgery or whatnot and they're not referred directly to like medical oncology or radiation oncology. So yeah, so I guess I'll stop there because I don't want to take the whole time. But that's what it looks like in Nova Scotia.
I am amazed. You have a lot of navigators over there, and even for screening, like this is so advanced when compared to what I know in my home province, Newfoundland and Labrador. But we are on time because I think Nicole and Jocelyn just joined us. Hi, folks, can you hear us?
Sorry about that.
No, that's fine. Hi, how are you doing?
Good, how are you?
We had technical difficulties, but anyways, here we are.
Here you are, and you are not late. Chantal has just given us an amazing overview of the Nova Scotia ecosystem of patient navigation, and it was amazing. So right now, you folks are from Newfoundland and Labrador. So let's learn about the patient navigation system in Newfoundland and Labrador a bit. So first of all, can you please just introduce yourself and then let's move on to the patient navigation in Newfoundland and Labrador.
My name is Jocelyn FARRELL. I've worked in the cancer clinic I can't believe it, but for 28 years. So I've worked all over the unit and I've been a navigator for 1 year.
All right.
Hi.
How about you, Nicole? Hi.
Hi, I'm Nicole. I worked on the inpatient unit at Health Science Center for Oncology and Hematology for 12 years. I worked in ambulatory treatment, which dealt with hematology oncology patients for 3 years. And I started the cancer center. That was over 2 years ago, but then I shortly went into this job as a navigator.
Right. So Chantal has been telling that there is a county-based navigation program in Nova Scotia. How is the situation in Newfoundland and Labrador? How many navigators do we have? Where do they serve? Which kind of population? Rural, urban? Can you give us some information about those?
So myself and Jocelyn, we take care of the Avalon Peninsula of the province. So, I mean, we deal with St. John's, Mount Pearl, but then there are some smaller towns in that as well. And across the province, there's 6 navigators between Labrador and West Coast, Newfoundland and Central.
So this is for cancer or this is for all?
Strictly cancer.
So we have like 6 or 8 cancer navigators in the province.
Yep.
Oh, that's wonderful. Okay, folks. So let's start with Jocelyn and then Nicole, and then we can move on to Chantal. How does a day in a patient navigator's look like? Patient navigator's work day. How does it look like?
Well, one thing's for sure, every day is a little bit different. We deal mostly with patients over the telephone.
Okay.
We are nurse navigators for the Avalon Peninsula, but in our province, the heart and soul of cancer care is in St. John's, which is on the island. So of course, radiation can only be given here. Many of the chemo treatments we give, especially when it comes to hematology and more complicated treatments, would be given here. So even though many days we have patients calling from here, we also have many calls from all across the province, because they're trying to either coordinate a patient's care or coordinate a patient's stay. So we really deal with the whole province, probably more so than the other navigators would. So typically, most of the calls we receive are about patients who have been newly diagnosed and are very confused about the possibility of treatment and how they will manage. The geographic obstacles are enormous in Newfoundland, of course, because we're an island and we're surrounded by little islands. So many people live in places that cancer care is not easily accessible. So if, we can't get them treated in their home, they're going to have to come to a larger center. A lot of it is travel coordination. A lot of it is education. Many of these patients are newly diagnosed, very confused, need to know what the future is going to hold. They are obviously treated in different centers, but they're all taught the same, mostly when they come for their initial visit. Myself and Nicole do a lot of follow-up teaching. Fortunately, we both have a background in cancer care, and lengthy one at that. So a part of our day, nearly every day, is taken up with teaching regarding immunotherapy, chemotherapy, radiation therapy, surgery. We do a lot of teaching.
Yeah. Okay.
Some patient, oh, I'm sorry, go ahead.
No, thank you for that. Go ahead, please.
Some of our day too is spent with people often who are from far away, maybe elderly. They may have sick relatives. Who knows? Every story is different. Many patients don't want treatment. They'll say no, even though it might be in their best interest. It is an individual decision. So we not only help people access treatment, we help people when they don't want to access treatment. And that, of course, is setting up things like palliation and home care and liaisoning with hospitals that are near them to help the journey along, no matter if they're treated or not.
There are some certain services that you have to get. So there's a patient I'm looking into right now getting interleukin injections. He has to go to Halifax. So we do also coordinate, not a lot, but with other hospitals outside the province as well.
Yeah, no, absolutely. These are amazing help. Like I can't imagine how complex it could be, complicated it could be at the face of diagnosis of cancer, but then knowing someone like you are helping them with so many different things, from treatment to travel to, referrals. This is amazing. Chantal, let's go back to you now, if you like. So does your service, so all of you said kind of that, you folks also educate about treatment. So do you folks also educate about precision medicine? Is it even a topic in the navigation?
Yes. So essentially we provide education regarding any type of our systemic therapy. So whether it's chemotherapy, immunotherapy, targeted therapy, a lot of the oral therapies that are now coming out. So there's definitely education that's being provided regarding any type of treatment. And obviously that also includes radiation treatment, as well as surgery. So I would say like a bulk, I would echo the same as the two ladies from Newfoundland, that my days are spent, they change every day. So every day you get different phone calls, different questions. Now being that maybe I don't know, I guess, but maybe I service a smaller, because like I said, we're county based. So I might service a smaller area. And I'm right in the hospital with our treatments, like our systemic systemic therapy unit in Bridgewater. So I do sometimes, a lot of it is over the phone, but I do sometimes get the ability to go see people in person when they come in for treatments, or if they come in to see our GPOs, so our general practitioners oncology that support the oncologist. And then sometimes too, it's going beyond that and helping support team members, even like within the hospital, like so patients that are coming through and are admitted for whatever concerns and they're being worked up for a diagnosis, or they're being transferred to Halifax, or they have questions, they will come see me if they know that it's cancer related.
Wow. Wonderful. How about you, folks in Newfoundland and Labrador? Do we also talk about precision medicine when a patient come make appointments with you? Is it even a conversation topic?
Okay, I guess indirectly, I mean, everyone gets their options of what's best for them or what plan is good for them. I mean, we don't go directly to the clinic area when patients first come in. A nurse does come in with them. And I mean, the doctor will go over what options they have and what they recommend or what have you. And then treatment options is then discussed with the nurse that goes in that clinic appointment with them. Now, some patients don't actually reach out to us. I don't know if the other areas everyone is seen by a cancer navigator. I'm not sure about that, but no, she's shaking her head no. Anyone who just needs a little extra go over some information. I mean, education when it comes to precision medicine is their main thing that we discuss with them, really.
Yeah.
What?
That's great. So we also wanted to have an Indigenous patient navigator here so that we could, tell about that great service as well. I know in Newfoundland and Labrador we have at least 3 Indigenous patient navigators, and probably in other Atlantic Canada provinces as well. So I just want to, do you know a bit about this program? Can you tell a bit about this to our participants, any of you?
I guess that I can go. So we do have Indigenous navigators in Nova Scotia. Finally, there's at least one, if not a couple, like per zone. So again, we're divided into 4 zones across the province. So if there are any patients that identify as Indigenous, they can be definitely connected with the navigator. The difference, I guess, is they're not necessarily cancer specific. So they're more like an overall generalized support for people that identify as Indigenous to offer support like through the healthcare system.
Right.
But we are aware of like their names and contact information and whatnot. And obviously, if patients come to me, they have specific concerns or questions, and it has to do with a topic that I feel like an Indigenous navigator could obviously help support, then I very much can refer to them. I think it's just a matter of like either giving the patient the information for them to connect directly, because I don't believe there's no actual like paper referral. It would just be by like phone call or email. So I can either help support that or provide that information to the patients.
Right. So I'm a bit familiar with the because I talked to Ashley Dicker a couple of times. She's one of our Indigenous patient navigators. So I know that as Chantal said, I think she's not specific to cancer, but she really connects with the Indigenous patients who come to St. John's for treatment, for example. Because as you folks said, this is the main treatment center here in St. John's, like radiotherapy and so on. So she helps from travel to translation to make folks feel at home, because for Indigenous people, she particularly expressed how important it is to be a part of their community land and so on. So when they need to travel to somewhere else, from Labrador to Newfoundland, for example, to get treatment. So it can be, it may. So this is where the Indigenous patient navigators actually tries to create a community feeling. So I think it's more than a navigation role. It's more like here is your community. I am here to help you. And sometimes we talk about the culturally appropriate care. Angela Hyde did right before this session. So their role is particularly critical. So I just want to thank all of you folks for doing such a wonderful job. I mean, I never needed your services, but if I ever need to, I know that I will be good at. So thank you so much. Is there anything that I miss from the Indigenous patient
I'd like to add
navigation?
one quick little thing.
Yes.
We currently don't have an Indigenous cancer patient navigator,
Yeah.
but we are developing that position. We do
Okay.
have a nurse in it, and many things have been done already. For instance, she's done end of life care with Indigenous patients, which is completely different. Many things particular to their culture. And I know
Yes.
that's been initiated. So I think that's going to be something in the next couple of years we're definitely going to have.
Oh my, that's wonderful. So maybe in the future events, we definitely should integrate such a topic into our conversation. Thank you for informing us about that. So how can people find you folks? I think this is another very critical point. Like, do they need any referrals? Does somebody tell them there is a navigator that can help you with a lot of stuff, or do their physician, family doc? How can anyone reach out to you and avail your services?
Will I go? There's a 188 number that we have. It's a CPN line. In first clinic visit, patient, the nurse that goes in with them does provide them with that number and kind of go over it. Or physicians do. We get a lot of referral. We do get referrals, even though you don't have to be referral or have a referral in to come in contact with us. I just find nurses in the clinic might say, okay, this person needs extra support or a little extra education, or they're not sure about something, or they, sometimes feel a little overwhelmed at the appointment and just don't hear anything. So they just might pass along little extra TLC. They'll give us a referral, say, please reach out to them. And we do reach out to say, hi, I'm here. This is my number, kind of thing. We get a lot of word of mouth as well. I find surgeons are really good at putting in referrals. Certain surgeons put them in for every one of their patients.
Okay.
So it's, education, very important.
Yeah. So the same thing for Chantal, I believe, right?
Yes, so it's very similar in Nova Scotia. You don't have to have a referral sent to get in contact with one of the navigators. We also have, I think it's a 1866 number. So if you, again, I guess, Googled cancer patient navigator or looked it up in some way, you should be able to find that toll-free number. And then it will, I think, redirect to the navigator. I think it works that, like, wherever you're calling from, it'll redirect to the navigator that's closest to where you're calling from. And then you can obviously leave a message for them or get in contact with that navigator, or all of our direct numbers are on that webpage as well. So we definitely get people that aren't, like, again, word of mouth, or they're self-referring. A bulk of my referrals do still come from the cancer center. So unfortunately, like, they are only being seen a little bit later. Like, they've already seen oncology and then are getting in contact with a navigator, when ideally we would love it to happen upon diagnosis. So there's definitely work throughout the province that's being done continuously to educate like primary care providers and stuff about navigation. Unfortunately, there's just so much turnover and also so much lack of primary care providers in our province that's probably a huge gap, is that people are only getting referred when someone either, like, happens to know about the role or goes through oncology. And then same thing, our surgeons, our pre-assessment clinic actually will refer all of our cancer patients, or in Bridgewater anyway. We have it set up. I don't know, I can't speak on for all the navigators, I guess, in our province, but in my hospital, our pre-assessment clinic for surgery will refer all of our cancer patients directly to me through that system when a patient has a confirmed diagnosis of cancer.
Perfect. So in the spirit of time, folks, I'm just going to scroll through the questions because they are really good ones. One of the questions is, how many patients do you see? Do you care for? Like, on the average, a lot.
Yeah, we don't have, there's no, we don't have a maximum for caseload.
No.
So again, we're county specific, so our caseload is not capped. So
Okay.
typically in a month, I mean, you can see anywhere from like 100 to a couple hundred of different encounters, I guess. Some of them are quick, like 5-minute conversations. Others are like hours of follow-up throughout the month. It really depends. But yeah, I did see that question pop up as well in the chat, specifically, I guess, about Nova Scotia. But no, there's no cap on our caseload. So you can reach out, and as long as you live within the counties, you can definitely be connected with a navigator.
How about you?
It would be the same with us. We
Yeah.
see many patients, and it's so hard to say how many do we see like in an average week, because some patients may, it's a 5-minute call, we never speak to them again. There are some people that I speak to more than I speak to anyone in my family. I'm dealing with them every day. I'm dealing with, you know, their issues, and it can be hours and hours of manpower. But when it comes to new referrals, I mean, I would say, you know, some weeks it would be 25, 50, who knows? It depends on the week. But like I say, some of these patients are so involved that you're speaking to them every day. I have patients I've been speaking to for a year now.
All right. I
So,
see.
you know, sometimes they never, we never leave. And
Yeah.
some more it's, you know, we speak to them once, problem solved, on we go.
Yeah, that's amazing. Amazing. So there's another really interesting question here. So are patient navigators involved in cancer screening as well? Like if someone, a newcomer, for example, immigrants or refugees or international folks like me, they come, they are not very familiar with the system. Can they reach out to patient navigators to actually learn about the cancer screening programs? Right? Oh, that's wonderful.
Yes.
I see the head shaking. Nice. I didn't
And
know that.
I think that there would be, and I've said this more than once, I think that another type of navigator we should be looking at is for people who are not from here, people who have immigrated, people who are not familiar with the system. It would be great to have a navigator simply for them. Immigration's huge. We have a lot of people from so many different countries coming here. That would be helpful.
Yeah.
But, you know, that's far in the future. But yes, we do get people from outside of the country who phone and say, look, I'm from wherever, tell me what to do.
Yeah. Oh, that's wonderful. Seriously, I didn't know that, and I'm going to talk about it all the time. You are going to get more patients, ladies. What can I do? So another thing, any question? There is a question. Are there any patient navigators in New Brunswick? Yes, certainly. And there is a concurrent session happening at the same time. That was a cancer patient navigator service for New Brunswick. So I believe recorded. So hopefully you can listen to that. And also you can, I think, maybe Google if you have the means to do so, to reach to that patient navigator system. So great. A lot of praise for nurses, navigators. Thanks again. And I think we really need to break right now, but I want to thank you, Chantal, Nicole, Jocelyn. I mean, seriously, from the bottom of my heart, I heard nothing but great things from patients about your role in their going through the cancer and journey and treatment or end of life. So thank you for everything, and thank you for joining us today. Now we are going to go for a break, and folks, we are going to be back at 3:30, but we have also the Cancer Patient Navigator service from PEI, pre-recorded by Michelle Barton. This is going to be aired now while we are on the break. So if you would like to learn more about the service in PEI, please stay tuned. So thanks again, and I'll see you folks back at 3:30. Thank you, ladies.
Thank you very much.
Thank you.
Take care.
Bye-bye.
Bye-bye.
Bye.